This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Is there a DPC clinician, tech vendor, or industry champion that goes above and beyond to further elevate the DPC movement? Nominate them for a DPC Innovation Award to recognize them for creating traction, embracing innovation, and demonstrating commitment to the movement. DPC Innovation Award winners will be announced and honored at this year's Hint Summit, taking place in Denver, Colorado, September 27th through 28th. Nominate a DPC innovator at summit.hint.com, plus get $50 off your Hint Summit 2024 registration with promo code MyDPCStory. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care, also known as DPC, is a fairly new, innovative model of healthcare that puts the care back in healthcare. It restores the relationship between the patient and their physician, cutting out all the middlemen that have their own interests in mind that drive up costs of care so that they and their organization can profit. In DPC, now that their care is no longer being controlled by admins and insurance companies, the physician now is able to practice the highest quality of medicine that they learned in medical school and residency. It brings a greater level of joy, satisfaction, and autonomy where doctors actually enjoy medicine and their life again. For any physician listening who is no longer enjoying their work as an employed physician taking insurance, please listen up and consider transitioning to DPC. I am Dr. Garrick Baskerville of METSI Care, and this is my DPC story.
Dr. Garrick Baskerville is a board-certified family medicine physician and the founder of METSI Care. He received a BS degree in biology from Penn State University and then received his medical degree from the Pennsylvania State Hershey College of Medicine and completed his residency at Christiana Care Health System in Wilmington, Delaware. He has practiced in primary care, urgent care, sports medicine, and occupational health or workman's compensation for almost 15 years now. Dr. Garrick is a national speaker and has spoken at the SXSW Conference 2019, was a panelist for the American Academy of Family Practice DPC Summit in 2020 and 2021, and many other times at schools, churches, organizations, and community events. Dr. Garrick is passionate about providing high-quality care that addresses all aspects of what makes us human beings, including mind, body, and spirit. He believes that care should be affordable for everyone, and that quality care takes time. That said, he believes a patient should have time to address their issues and not feel rushed during a visit. At METSI Care, the visits are 30 to 60 minutes if needed. When he practiced in traditional insurance-based models of care, he was scolded by administrators when he wanted to spend more than 15 minutes with his patients. That didn't sit right with Dr. Garrick, and he told himself back in 2012 that he would eventually start his own practice where he could provide the care he believes in which everyone should have access. With that, he founded METSI Care. Dr. Garrick is also a photographer, where he enjoys capturing human expressions of joy and excitement. Dr. Garrick started photography using his dad's professional Minolta camera after losing his father to multiple myeloma in 1997. He used the camera as a way of healing and connecting with his father, which he still does today. Dr. Garrick decided to attend medical school because he wanted to be the doctor for other people the way he would have been for his father if he could. In his free time, he also enjoys creating and cooking healthy recipes as a freestyle cook and attending live music events, comedy shows, art shows, and performance art theater events. He was an extra in season 3 of House of Cards, and he was fabled with learning the bass guitar and hopes to get good enough one day so he can start performing. Dr. Garrick opened METSI Care in November of 2019. Welcome to the podcast, Dr. Garrick.
Thanks so much for having me, Mary Al.
You have been open since 2019. And in the past, you've mentioned that your dad and the healthcare that he received when he was diagnosed with bone cancer really impacted your career choice and your journey into medicine. So I wanted to start with asking, what was that experience like with your dad, and how did that actually end up in you choosing medicine as a career path?
Yeah, thanks so much for asking that question. So first off, I've had interest in science and and being a nerd, a science nerd, since I was a child. I remember drifting off in my brain and thinking when my teacher, my third grade teacher, Mr. Rothman, was talking about rocks, I remember saying to myself in my head, oh my God, this is really awesome and exciting to learn about science. And I said, I'm going to be a doctor one day. So that was the first time that I ever thought about becoming a doctor. And then after my father was diagnosed with cancer and I was one of his caretakers when I was 13, 14 years old. And then I saw him to his demise and his death when I had just turned 16. I realized that I was unable to help him. Of course, I wasn't able to help him in the way that that had a lasting effect on his life. And so I said to myself, this is going to be my career path. There was nothing that was going to stop me from doing medicine. Previously, I'd come up with these other alternative careers that was going to be a little bit more of an easier path. I had thought about becoming a businessman, if you will. And I had also thought about becoming an actor and playwright when I was in high school. But it was solidified after my dad passed away that I was going to become a physician.
I'm so sorry for your dad's passing, and I cannot even imagine losing your dad at 16. I lost mine in my 20s, and just being a 16-year-old and handling that is definitely something that not all kids can go through and then thrive afterwards. So it is such a testament to your dad's impact on you as well, that you have been able to use his experience to help fuel your passion for medicine, because you bring up how you thought about being a business person, doing acting, and also thinking about being a doctor was in the mix. And so by creating your own clinic, how have you been able to still be a creative and to still do things outside of medicine?
Yeah, so the beauty of direct primary care is it frees up the physician to basically cater their own schedule to their lifestyle. And the patients that select that doctor is usually going to be okay with it and understand that the physician has a life outside of work, but also wants to be there for their patients. And so with my direct primary care, I have office hours where I'm available, but I also make sure in my evenings that I have the time to do my creative outlets, including going to concerts and small music shows with my other music loving friends and hearing the local community musicians perform. And some of them are my friends. Some of those performers are and then I love singing along or air drumming or air bass playing, because I do have an interest in learning the bass. I have a bass guitar. So it's fun to be able to attend music events. And that's one of the biggest things that I do as far as my creative outlet is to attend music and talk about music with friends.
Amazing. So I want to go back to before you were a DPC doctor, before you opened up your practice. You had graduated from medical school at Hershey, and then you completed your residency at Christiana Care. And that life compared to now, what was your outlook on your career like at the time? Because I'm guessing you didn't have as much time back then to do these things that you just described.
Yeah, that's true. As someone who loves the wide scope of family medicine and do a whole lot, I had aspirations to be a great family doctor and see patients grow from birth to death and be a big impact in that. And the unfortunate thing that happened after I graduated residency was the metrics of hospital organizations putting limits on actually connecting one-on-one to your patient and having the ability to enjoy the moment of being with another human being. So I felt the pressure of the organization that I worked for at the time that I was unable to connect and to get to know my patients on a human level. And it was more about how quickly could I get the patients in and out. So frankly, I would meet the metrics, so I was not let go.
So many people listening to this podcast can absolutely relate to that when you get so involved in how many RVUs, how many FTEs, how many numbers am I worth as a physician, it's not about care. It's not about quality of care. Yes, like you can argue that, by meeting that A1C of 7.1, you're actually doing patient care, but it's no, because 7.1 is a cookie cutter number and that doesn't fit everybody. It's so frustrating. And you've said this before. You said that in 2012, it just didn't sit right with you. And you were scolded by your administrators in terms of whenever you would take more than 15 minutes, you would be penalized for that. And that is definitely something that people don't believe that actually happens when they're not in medicine. And it definitely does affect people who are paid by RVUs. It's an ugly truth about medicine.
It's horrible. And for those that are listening that don't know what a RVU is, it means relative value unit. And it's basically putting a monetary value of what the physician is doing for you. And there's an incentive to basically have as many RVUs in the year as possible for the doctor to meet the metrics so they can actually maintain their employment with the organization that's paying them, because that's linked to a salary. So if the doctor is not meeting their RVU requirement, the administration can let the doctor go. They can fire them. And it's usually the really good doctors that are actually bringing in less RVUs because they're actually spending time with the patients and they're not rushing them through. Those are the ones considered by the organization as being ineffective. And they use these kind of business administration words to basically say they're inefficient or not effective or whatever, but they're inefficient in bringing in money, but actually the care that they're providing is actually amazing care, because the most important thing that a physician has with a patient is actually time. And the time is needed to accurately diagnose a patient and to care for them in the way that they are meant to be cared for. And unfortunately, with the way insurance-based care is, they take that time away. And I can share with you the first day of medical school, or it was actually the day of our white coat ceremony. I remember at Hershey Medical School, the dean, his name, Dean Davis, amazing physician whom I learned a lot from. But he said, students and parents, I want to, tell you this one thing, but the most important thing that you have and that will help you get to the right diagnosis with your patients is sitting down, listening to them, let them tell you the story, and any additional time you have, you do a physical exam to confirm what you're thinking, but you already know what's going on because you listen to them. And then any lab testing is meant to support that diagnosis, but not to search for the diagnosis, because you pretty much should have already an understanding or an idea based on your history and your physical. And this is something that has been unfortunately lost in medicine. Dr. Davis, who shared that with the Penn State Hershey Medical School students, and I'm sure he did this every year. This is something that we, along with other, physicians, value, is actually the time with our patients, listening to them, examining them, and using labs as to support the diagnosis, but not to search for one, because we should already have a good idea of what's going on. And a lot of patients don't understand this. They think we need lab tests and imaging tests to figure out everything. And unfortunately, the system of insurance-based healthcare and administration, they have an incentive for doctors to do a lot of lab testing and imaging testing, which may be unnecessary, because it's bringing in financial gain for that organization. And direct primary care doctors, we understand there's a problem with that. And that's why a lot of us have opened our own patient clinics so we can provide the care for our patients without doing a whole bunch of unnecessary lab tests, imaging tests, and referrals.
Definitely. And It's so interesting because partially because of the pandemic, but also because the system continues to be atrocious for our patients, is that it's not only physicians who are realizing that time matters. And like you said in your intro, that it's a relationship-based care that we all want to provide in family medicine, internal medicine, pediatrics for primary care, as well as specialty care. But too frequently, I hear no one's ever spent this much time with me. And I hate hearing that. It really kills me when I hear that, because I'm like, okay, I'm so sorry that has happened to you in the past. That should never be the case with anybody, but I hear that so often. I want to ask there, when you had heard Dr. Davis, when you had experienced these administrative slaps on the wrists or, the fear of being fired, I want to ask, at what point did you start thinking about, if I could do it differently, this is how I would do it? And how did that transition into METSI Care?
The thought of it first came in 2012, 2 years out of my residency graduation, but 2 years of practicing and having my first job working for a large hospital system. So my first job out of residency was working for a Federal Qualified Health Center, or FQHC. That was an amazing experience. We didn't have the same metrics working basically for the government. And so they wanted us to provide good care for basically a low income population who was either Medicaid level, below Medicaid, or just above Medicaid. So we took care of people that had Medicaid or were uninsured and underinsured. And we provided really great care at that organization. And I'm happy to have worked for them. And then I moved on to working for a large hospital system in 2012. And then that's when I first learned about these metrics that we didn't have at the Federally Qualified Health Center. And I knew that there was something wrong because these metrics were taken away from actually quality care, because it was taking away my ability to sit down and listen to my patients and connect with them. And that is really the way to have a good relationship, doctor-patient relationship, which involves trust. And the trust is broken to an extent when the patient feels unheard or unlistened to, or that the doctor is standing up and standing by the door because they're trying to get out of the room because they don't want to get in trouble from the organization who keeps time on the physician. And this is something that many listeners may not know. All the physicians know this, but the doctors, through the electronic health system, every interaction you have with a doctor is recorded in a time basis by the organization that's paying that doctor. And this is for insurance-based practices. And if the doctor spends more time than is allowed by that organization, their job is in jeopardy. And so I'm getting to, in 2014, the organization I was working for, they had a meeting with me in my office in 2014. And they said to me, "Hey, Dr. Garrick, your patients love you. You have really high Press-Ganey scores, but your average time with the patients is 22 minutes. And they said the average time that the other physicians have in this network on average is 16 for that interaction. And they said, we're going to have you decrease your time by 6 minutes. And they also said to me that to help incentivize you to drop your time with your patients so you can be on par with the rest of the doctors in our network, they said, we're going to have you do a performance improvement plan to get down to that time. So going from 22 minutes to 16 minutes. And that involved cutting out mental health treatments with my patients. And I can share with you, mental health is actually one of the number one things that I do currently, and I did back then for my patients. I have a huge interest in treating diseases such as depression, anxiety, bipolar disorder, and I've even treated schizophrenia effectively in my practice. And the organization I work for, a hospital-based organization in the suburban Philadelphia, said to me, you have to stop doing all mental health treatments. And for those who may not know, but the number one place for actually patients in this country to get care from for mental health is from their primary care provider, whether it's a doctor or nurse practitioner or physician assistant, but it's through primary care. And that includes internal medicine, family medicine, and pediatrics. And so they were telling me that I was unable to do the thing that I loved so much in medicine. And I thought about all of my patients that I was taking care of, that they were effectively being treated. And my patients in the community that I worked for, it was a blue collar community. And they said, Doc, we are not going to get care for mental health at any other place other than seeing you. And so with this conversation I had with the administrators from the organization I worked for, I was deeply saddened that I was no longer going to be able to care for them in the way that I had been. And I didn't know how I was going to tell them that I could no longer provide mental health treatments for them, because the organization said that 6 minutes mattered more than my patients did. And so the following week, I quit that organization because I knew that I would not be effective anymore as a physician. And then I transitioned into urgent care at that time. And because urgent care at that time in 2014 didn't have the metrics that they now have today, which is similar to the metrics of being an employed physician for a large health system. The quality of care throughout my career has, in my opinion, decreased. And the reason it has is because of the greed of administrators, hospital administrators, because of insurance companies, and because of pharmacy benefit managers. It's really ruined healthcare. And so the doctors that choose to do direct primary care, what we're doing effectively is restoring high quality care by not having these metrics or not forcing the doctors to limit their time with the patients, because we know that's where you get the best bang for your buck, if you will, is spending a couple extra minutes. And there's many studies to support this, but adding a couple extra minutes to a visit can have a profound effect on the cost and effectiveness of healthcare. But unfortunately, the shorter time the physician spends with the patient, the more cost downstream will occur. And it's better for the health system as far as, because they're going to make more money the less time that the doctor spends with the patient. I mean, they know this. And this is why they're trying to force employed doctors to spend less time with them, because that means there's more referrals, there's more unnecessary lab testing, there's more imaging studies, just because the doctor didn't have enough time to sit with them, with their patients.
Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes. Yeah, and it's too many physicians who have transitioned or not transitioned to DPC have told me similar scenarios in terms of, I totally could do the workup. Like I have the training to do the workup, but I don't have the time to do it. So I'm just going to refer. I'm just going to do this lab because that's what I have time to do. And just prior to our chat, the California Academy of Family Practice offered this test your interviewing skills. And I was like, sure, I'll sign up for that. It was a 15-minute visit that I did with a standardized patient. And I was so uncomfortable because I felt like I was looking at the clock the whole time. I had to rush. And I am so not used to 15-minute visits. And so I was extremely uncomfortable because just that life of you literally have to then tell them like, you can only do one problem today. You're going to have to make another appointment. I'm sorry if you still have that pressing issue, but my next appointment is in 4 months from now. And there's so many problems with the time-centered care rather than, and it's not even care, the time-centered visits versus relationship-based care. So thank you so much for highlighting that. And I thank you for sharing your experience. It's also atrocious that when you talk about relationship-based care, that yes, in this country, where do people have to go when therapy is not covered by insurances a lot of time, or maybe one or two visits are covered and then the cost of therapy can be very restrictive for patients because it could be over $100 per visit. And when you look at direct primary care, when you have your physician who you can text, email, call, whatever, who costs, that price per month, it's just crazy to think about how you as a primary care doctor were asked to not be that physician who could care for the whole person. So just thank you so much for sharing that.
Yeah, thank you for allowing me to share it.
Now, when you had started in 2012 developing this plan to open up a clinic that was run the way you wanted to run the clinic and the way you wanted to take care of patients and designed around the way you wanted to take care of patients, how did that end up into actual steps to open METSI Care?
Yeah, thanks for asking that. So back then, it was really just a dream. I didn't really know how to get there. I did not know about direct primary care back in 2012 when I was first unhappy, and then 2014 when I considered quitting medicine completely because of where I saw healthcare going. And the shift was shifting from patient focus to profit focus. And that's when I was going to leave. Thank God I transitioned to urgent care where it allowed me to stay happy for a couple more years. And then when I was doing urgent care, I somehow learned about direct primary care. And I don't remember how I first learned about that there was another model. But when I was getting unhappy with working at urgent care because it had started to have a similar problem of the family medicine I was doing previously, I originally was just going to open up a cash-based business and just charge per visit because I didn't know anything about direct primary care. And then when I learned about direct primary care, that it made sense. It's simple and easy. It makes access very easy for patients. There's no more 5 to 60-day waiting period to see a family physician, which depending on your area, it could be the time that it takes to see your doctor. And the time was actually restored back where the physician could have time with their patient. And as soon as I learned about that, I'm like, that's exactly what I want to do. And so I wasn't ready to leave the job that I had when I first learned about direct primary care, but the conditions of my work
environment continued to worsen, where there was more stress on bringing in revenue, billing for things that I didn't agree with me. I didn't agree with what I was asked to do. And I got to a point where my ethics had to tell me that I could no longer work for the organization that was paying me, because the care that they wanted me to do, I believed did not match with my ethics. And so that was what forced me to say, hey, listen, if I'm not working with this company and they're trying to push me to do things, I didn't think that any other employed position would allow me to practice the medicine the way that I felt should be best practice. So I said, if I'm going to still be a doctor, then I'm going to have to start my own practice and practice medicine the way that I was taught and the way that I wanted to care for my own father, who had passed away many years before. That's what drove me to start my own direct primary care concierge practice.
When you were deciding to open, did you have steps that you took in terms of looking at your budget, in terms of scoping out a location? What were the steps that you made before opening day for your practice?
Yeah, just to share with those who are listening and interested in starting their own direct primary care practice, for me, from concept to opening was about a year. And some people might say that's a long time, but it was necessary for me I still actually had another job. So I was doing locum tenens work, and that involved flying to other areas to work where I'm licensed. I was doing as much reading as I could, read the direct primary care books that are out there. I read different Facebook groups to learn more about direct primary care. And I got as much knowledge as I could about direct primary care. I came up with a logo. I created my business entity, EIN, got my bank account, started doing a little bit of marketing through Instagram, just so people knew that I was coming. And then I found a location, which took a while. That was one of the things that took really the longest time to find, was my actually physical location, because I knew I wanted a physical location. And it was hard for me to find one that was affordable. A lot of the physical locations in Austin was running about from $6,000 to $8,000 a month for about 1,000 square feet. So just so some of the direct primary care doctors that are outside of Austin, they may not know this, but
That's what I was quoted for the places that I was looking at back in 2019. So it was very expensive. Thank God I was able to find a location that was not that expensive. It's still expensive, but it was a little bit better than $6,000 per month for rent. But yeah, so once I found the location, we did some construction to make it fit the needs of my clinic and my patients. And then we opened in November of 2019.
Amazing. And before we go on to after you opened, when you're sharing about your urgent care experience, was that also in Texas or in the Austin area, or was that in a totally separate location?
Yeah, so I worked for 3 different urgent cares after I stopped working for hospital-based family medicine clinics. But I first had urgent care experience in Philadelphia and surrounding Philadelphia areas where I'm originally from. And then I was recruited to come to Austin, Texas for another urgent care. And I worked for them. And then they actually let go of every physician because of money, and they rehired nurse practitioners to replace the physicians. And so I had to find another job. So I found another urgent care job, and I was the medical director for that urgent care. And I did that until I couldn't anymore.
The reason I was asking that was because recently, Dr. Erica Bliss, we talked about non-competes, and Dr. Doug Ferrago had put this on DPC News, that this terrible story of a physician who was planning on doing DPC, but then the company that she worked for she's now facing legal action basically because of a non-compete. So I want to ask, in Texas, are there enforceable non-competes in Texas?
To the best of my knowledge, the non-competes are hard to enforce. And also to my knowledge, because we're not necessarily competing with the same clientele, because we're cash-based and we're not taking insurance. So the organizations that we have left are insurance-based, and most of the patients were in customers. That's my understanding in Texas, that we don't have the same kind of issue with starting direct primary care here and with enforceable non-competes, because they're really not enforceable. The good news about the company that I worked for, because we did a lot of work injury care, my boss told me that when I opened my own clinic, that they wouldn't enforce a non-compete. So that was actually good for me, because what we did mostly was work injury and not family medicine.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad. Gotcha. So now I want to jump back to, you shared how you found your space. Thankfully, you found a space with a lower price tag on it, and you had designed your logo. During your opening time, you had a ribbon cutting ceremony. I really want to highlight that, because you had Congressman Chip Roy attend your ribbon cutting ceremony. And so for those people who are doing in-person ribbon cutting ceremonies, how did you end up getting a congressman to come to your event and as a result get a lot of media attention because of it? Yeah,
so it was kind of funny how that all happened. So the media found out that I was starting. So originally, METSI Care was a company exclusively for creatives. Now the pandemic changed all of that. But when I started out, I was in an affordable, accessible doctor's office that was tailored towards the creative community. And there was Spectrum News, local Spectrum News here in Austin. They learned about that. They sent a reporter to do a story on me. It aired. Congressman Chip Roy was actually at home, and he saw it and he watched it in its entirety. And then he had his chief of staff reach out to me and said, hey, I want to talk to this guy, because he was intrigued and he actually supports direct primary care in the model, very much so. And he believes that this is the way the care should be, to create competition, to provide, to help bring costs down of care because you have competition, and to improve access of care, because the barrier to assessing a doctor is less than if you need to have insurance. So he actually sent his chief of staff to my office. We had a time, and I spoke with his team and told them what I'm doing and how I envisioned growing as a company, and how I wanted to help even more and more people. And then when it came time to want to do a ribbon cutting a couple months after I opened, I reached out to his office and said, hey, do you mind having the congressman come to the office? And they immediately responded and said, absolutely. What date are you thinking? And just so happened that he was coming to have a meeting later that day in Austin with a distinguished general. And he said before he met with the general, he was going to come and stop and do the ribbon cutting with me and my family and other community leaders here in Austin. And so that's what happened. So he came, he showed up. It was beautiful. And I'm very happy to have had Congressman Chip Roy come to my ribbon cutting ceremony.
I just love that it's just, you never know who's going to listen to your story. You never know who's going to value DPC as a patient or as another physician. And so the fact that you were just featured on a news story and you were seen by a congressman who cares about DPC, it's just fantastic. Just so serendipitous. I love that.
Yeah, definitely serendipitous, but it was a great experience.
So now you alluded to that initially your exclusive focus was the entertainment and arts community and creatives. And so now METSI Care has evolved in terms of not necessarily being exclusive to, but including the arts community. Can you share about how your clinic has transitioned and how you've transitioned since opening?
Absolutely. So, so we just talked about the ribbon cutting ceremony, which was February 20th of 2020. Now, that date was very significant to me because that was on my father's 92nd birthday. And so my father was born 2/20 of 28. The twos are very important, and that was on his 92nd birthday. So I wanted to have, or would have been his 92nd birthday. So I wanted to have that ribbon cutting ceremony on that date. So 2/20. Nice. And 3 weeks later, the pandemic hit. Okay. Everything shut down March the 16th of 2020. Now, March the 16th is a significant date, which is also a little serendipitous, but that's actually the day my father passed away.
Wow.
So the day that everything shut down was actually the same day that my father had passed away in 1997. The dates are in numbers to me are profound, and it's kind of crazy how the whole world shut down on the day that my father passed away. But that date also started to really affect my clinic and the ability of my patients to continue to afford access to me, even though my prices were very low. They were well under market rate, about 31% under market rate. But I started to lose my patients one by one. And then another day I would lose 5. The next day I might lose 10. The next day I lose 15. And I'm hemorrhaging patients because my patients were no longer employed. They were food service workers, musicians. They worked for venues. Everything was shut down. And my clinic was hemorrhaging patients, and those who were still trying to afford to continue paying for access to me, they would call me and say, hey, doc, I still want to stay with you, but I'm really having a hard time staying with you. So then I had to start allowing them to be free. And unfortunately, I couldn't provide care for free because I still had a lot of bills to pay. I still had my medical school loans, my mortgage, and my rent. And so I had to figure out how to continue to have the business survive. And for me to do that, I realized that I had to branch out to the people that were actually thriving during the pandemic. And those had to do with high net worth individuals were thriving. They were able to buy up things as people needed to sell. They buy low, and then they're buying, more property, stocks at a lower number and doing very well. And one of my friends encouraged me to add concierge services to my direct primary care. And he shared with me, he said, Doc, you want to help people. And if you have no company, you can no longer help people. And he said, the only way for you to continue your business, because he knew that I was losing patients every day, he said, was to start taking care of people. And he said, you have to start taking care of people like me who have the money to pay for your services. And so he encouraged me to start doing yearly concierge plans to help get some revenue back in the business and provide concierge level services where I actually go to my patients' homes. I send phlebotomists to my patients. If they need anything, I go to their home, and they appreciate the access that they have with me, including the weekends, but also the privacy that they get because things aren't being billed through insurance. That adds an extra level of privacy to their health data, and they really value that. And so I'm very happy that I've been able to do concierge medicine and get compensated for the value that I'm bringing to my patients.
And it brings up this, like how your friend shared with you, if you don't have a business, you can't help anybody. It's like that old adage, you have to take care of yourself before you're able to take care of others. Because if you are burned out, stressed out, you're emotionally depressed, whatever it is, where you're not being your best in front of your patients or with your patients, that's an unhealthy relationship. So I thank you so much for sharing that. In terms of pricing, on your website, you have featured pricing that's specifically geared towards the creative community, as well as this concierge level of DPC. So can you talk about pricing and how that's working out for you in terms of billing? Because you mentioned that the concierge patients aren't necessarily using their insurance. So how does that all work for you in terms of pricing and billing?
Yeah. So I have different levels of service to meet my patients where they are and to provide the level of care that they request and require. So I still have monthly plans. Unfortunately, currently my monthly plans are full for subscription, but the monthly plans are still catered towards the creative industry, including service industry workers. But I'm still losing those patients that are paying me monthly, and then that's where I'm getting the most attrition. So as I lose patients from that, my patients on the waiting list to join METSI Care as a monthly member, because they're in the service industry, I'm still able to add patients fairly regularly because there's attrition with the creative industry, a high attrition, unfortunately. And it always goes back to finances, which is unfortunate. And then I have my yearly plans, and I have 3 different yearly plans. They're not all on the website, but I have a yearly plan for access during regular hours. So it's not a concierge, it's access during regular hours, and it's in office only. And then I have a plan that is concierge. It's in office only, but it's every day. So they get me on the weekends as well. And then I have a plan where it's home visits exclusively if they want it. So I don't have requirements that they need to have a certain thing for me to go to their home. So it's home visits exclusively, including the weekends, after hours, and they get me pretty much whenever they need me for that highest level of concierge. And yeah, so I have 4 different plans.
And I'm such a huge fan of if you've seen one DPC, you've seen one DPC phrase. But with this way that you've set it up, I want to highlight the word of concierge, because definitely there are some in the community that have opinions as to whether or not somebody should muddy the waters with concierge or not. But in terms of in your community, when it comes to marketing, when it comes to opening a new practice where direct primary care might not exist, can you tell us a little bit about your thoughts using concierge as a phrase in your pricing and in your offerings?
Yeah, great question. And I'm sure a lot of the listeners want to know the difference between direct primary care and concierge medicine. There's technical differences, and there's what the patients really care about. And so for me, I don't use concierge in that verbiage on the technical side, because technically concierge medicine is doctors that take a retainer basically for access to them, but they still bill insurance for everything. I do not do that. I do not bill insurance at all for anything. But concierge is a word that the patients value in my community. We have millionaires, lots of millionaires in Austin, Texas. And we have a lot of billionaires in Austin, Texas. So that clientele wants an exclusive doctor. And so they're looking for concierge doctors. They don't really care whether they take insurance or not because the money really doesn't matter to them, but they want a concierge doctor. And if you do direct primary care, you're really doing concierge level of service, whether you want to call it concierge or direct primary care. But with marketing and trying to talk to folks about what I do, when I used direct primary care, they were very confused. And anyone who is trying to do sales, which as a direct primary care doctor, we are salesmen and women, but I was having a hard time selling direct primary care because people didn't know what it meant. Okay. And I would explain it to them and they were still confused. They said, Doc, you've explained it to me. I'm still confused. And then I say, hey, I'm a concierge doctor. They're like, oh my gosh, tell me more. I want a concierge doctor. So just with the using different terminology, there was a greater interest when I said I'm a concierge doctor as opposed to I'm a direct primary care doctor. So I just stopped using the concierge, the direct primary care verbiage because it was confusing patients. And so now I use that I'm a concierge doctor, even for my monthly direct primary care patients, but they understand now what I do instead of being confused.
Gotcha. And now looking back at that medically trained employed physician in 2012 to now, I want to ask, as your practice has developed, as it's opened, as it's transitioned and evolved to including creatives as well as this concierge offering in your practice, I want to ask, are you happy? Are you happy that you chose this life and why?
Yeah, thank you for asking that. I can share with you when I was employed, I was not happy because I was not able to provide the level of care and service to my patients the way that I knew that I could if I was working under different circumstances. And I can share with you as a direct primary care / concierge physician, I am happy now because I actually am able to do amazing things for my patients that I would not have been able to do. And I can share with you, many of my patients are shocked that I'm saying, hey, I can take care of that because they're so used to being asked to be referred out for so many things. And when they learn that I'm able to care for it a lot of times easily in my clinic because I have the time to do so, they're like, oh my gosh, I didn't know you did that. Like I had one patient that thought that I needed to refer her to a psychiatrist for the treatment of her anxiety and depression. And I was like, no, I had another patient who thought she had to be referred out to a dermatologist for treatment of her acne and a mole she had on her back. And I was like, no, I actually do that. I can biopsy your mole. I can treat your acne. And actually she's doing great. So these are the things that family medicine physicians can do if we're given the time to do so. Yeah. So I'm very happy because I have the time to take care of my patients and actually able to treat my patients as humans and connect with them on a higher level than I was ever able to do as an employed physician. And then the last thing is the autonomy. So I have the time to create my schedule the way that I would like. So if I know that I wanted to block my schedule for a time that I want to do something, whether it's listen to an educational seminar that might be during the day and I might not have been able to do that previously, now I can do that. It's a beautiful model of care that I'm so happy to be part of.
And is that happiness, does it have anything to do with the fact that you prefer to be called Dr. Garrick rather than Dr. Baskerville?
Yes. So when I was an employed physician that took insurance, I was called Dr. Baskerville. And through my feeling beat up by the organizations that I worked for, Dr. Baskerville had to go away and metamorphosize into who I really am. And that's Dr. Garrick. And for me, I love being Dr. Garrick because Garrick is who I am. That's my name. That's who I am. And I felt like Dr. Baskerville was someone who had to rush to see patients to keep his employer happy, to keep his job. And that's not something that I wanted to be anymore. So I'm so happy to be Dr. Garrick because I'm able to spend 2 hours if I need to with my patients. And I've done that many times, specifically for my depressed and suicidal patients. I spend a long time with them and I've been able to effectively help suicidal patients specifically. I've helped at least, I would say, over the last 2 years. And they were on the brink of suicide attempts, some of them, and also thoughts. seriously, and I was able to help them. So you can't put a value on saving a life and actually having them become part of the workforce again. So some of my depressed patients, they were no longer working. Now they're effectively working in our society again, because they were able to have access to a doctor that they were not able to previously because they didn't have insurance. So those are the kind of things that we do as direct primary care doctors. We literally save lives.
One thing I definitely want to include is back in 2019, on a social media post, you had written this quote that I thought was incredible, especially for people who are brave enough and have the network and are making this decision to do DPC. But your quote was, "When you are facing self-doubt, fears, or other setbacks, keep going. Nothing can get in the way of your vision as you are in control of your own destiny. Remember your why when times get rough. You feel too tired or just got off your current day job." So I want to ask, in terms of when you wrote that quote, what was going on? And as you reflect on your DPC life thus far, what's been your worst day and what's been your best day that keep you going?
Thanks for asking. And I distinctly remember writing that. I remember I was in a healthy food store that was about to close in Pittsburgh, Pennsylvania. I had just gotten off my 12-hour urgent care shift. I was extremely tired. I was extremely hungry. I hadn't had a chance to eat at all that day. And I had my computer on and I was on their Wi-Fi, and I was about to, work on my business because I hadn't launched METSI Care yet. I was just a couple weeks away from launching when I wrote that quote. And, I was feeling tired and I was feeling exhausted. But that quote reaffirmed to myself why I was doing what I was doing. And, the why for me has been from the beginning of when I entered medical school was to be able to provide the highest level of care to folks the way that I would have for my father had he been still living. And so that's the kind of care that I give to my patients. And I believe everyone should have access to that. So I really, wanted to tell myself that I could keep going too, even though I'm tired, even though I needed to still figure out ways to make money because I had quit my job, as I had said earlier. So I was doing, travel gig work, as a physician, and I was exhausted, and that working for that urgent care was a great experience to push me into the DPC. And then as far as my worst days in direct primary care really has to do with when I lose patients due to them being unable to afford my services anymore, or when I lose them because they are no longer to afford to live in Austin and they have to move away. And it hurts me because my goal was to make the model that I have affordable for everyone, including, the creative industry. But unfortunately, a lot of them still weren't able to afford Austin prices and have had to leave Austin. And we've lost a lot of patients because they had to move from living in the city of Austin because it's so expensive now. So those have been my saddest days in direct primary care because I'm losing that relationship, with patients that I truly care and value. And my best days in direct primary care, really when I know that I've made a profound difference on someone. And I can share with you the last one, because I have them regularly, but the last one is a patient who I've been treating for the last couple of weeks with multiple abscesses that he has in his abdomen from injecting growth hormone and testosterone that he got off the street. He used dirty needles. He reused needles. And now he had, because I'm treating them and he's getting better, but he had 6 abscesses in his abdomen that had to be drained. He had to be given IM antibiotics and oral antibiotics to help him heal. And each of the wounds have been incisioned. They've been drained. They're packed. And he comes every 2 or 3 days back to my office for me to care for these wounds. And he's getting better. And he was trying to deal with this at home, but for weeks. And because he was uninsured. And then his wife actually told him that she remembered that I had started my direct primary care practice and she referred him to me. And I'm so happy that I've been able to take care of him because he is so grateful that for a low monthly fee, he's paying me $100 a month but he's been able to get care that would have cost thousands and thousands of dollars for the care that I've been able to provide for him. And, he's been back in my office now 4 times, and this is his first month of being a member, and he's only paid $100. And that would never happen in insurance-based practice. So I'm so appreciative of what I'm able to do and how I'm able to make a difference to patients every day.
It's so clear that you have your why and what keeps you going. So awesome. Thank you so much, Dr. Garrick, for joining us today.
Thank you so much for having me, Marielle.
Next week, look forward to hearing from Dr. Grace Torres-Hodges of Torres-Hodges Podiatry in Pensacola, Florida. A shout out here to listener F&H Mom, who left us the following 5-star review. This is the podcast where you can hear the stories of other docs paving the way in direct primary care. Each episode features a different practice that offers a wealth of wisdom for starting your own practice. I look forward to Mondays now because of this podcast, a must listen. Thank you so much for taking the time to leave a review, F&H Mom. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Please leave a 5-star review on Apple Podcasts and Spotify now as well, as it helps others to find all these DPC stories. And lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC, check out dpcnews.com. Until next week, this is Marielle Concepcion.